281 Care is the face of community mental health for Hamilton County. It is many times the front door for those unfamiliar with our system. Last year, 281 Care received over 24,000 incoming calls. These calls vary from people seeking information to those who are experiencing a mental health crisis.
Well, I work in the central registration team. All of our new clients come through, and what we do is basically do a short assessment, get their basic information, and kind of screen to find out what sort of services they might need help with. Our 221 helpline is the number that we use, 221-4357. That is the phone number where they can call in. That is our live line. We also have a 281 Care line, which is our 24-hour hotline for anyone who just needs to talk or vent. Pretty much there's someone there, always there to talk. It's kind of, there's always a good resource to have, because through the not just 9 to 5, people have different issues or different problems they need to talk about. There's someone there 24 hours a day.
Our goal is to provide the information needed to stabilize clients in crisis. For assistance with emergency care, call 281 Care anytime, night or day. It is estimated that 15% of the population needs counseling or other behavioral health services. Centerpoint Health provides those services to children, families, and adults at all 5 of our sites. Counseling clients are seen on average about 10 times. Typically, clients are seen more often in the early stages of treatment and less often as treatment progresses. All of these counseling services are provided by master-level licensed clinicians in conjunction with a psychiatrist if needed.
I do child outpatient here at Centerpoint, and I've been here for about 2 years now. I tend to see a lot of younger kids. I have a couple of teenagers too, but mostly younger kids. And lots of times I use different activities, because for me I found that children don't really respond to just sitting here and talking. And so what I tend to do is come up with different activities that we can work on that will help them learn the skills that they need. Sometimes we'll play games, but the games will help them think of anger management skills. Or I like to do a communication game where the parent and the kid comes in together and work as a team to accomplish something and work really and improve their communication skills. I've had a lot of cases that are really I've seen them grow, and the parents grow, and the kids really make a lot of improvements, and that's always fun to discharge them successfully. Here's your little present, and you're off, and you've graduated from therapy, and those are always neat cases.
Adolescent parents and their children are often at risk for medical, psychological, or social problems. Our teen parenting services are designed to help young parents create a more positive future. The teens receive parenting education, home visits, and emergency assistance while participating in peer support groups and individual case management.
The Kids Hope program is the school-based component to our parenting program. We go into about 13 different schools a year and work with the teen parents in that particular high school, both mothers and fathers, and we administer a child abuse and neglect curriculum to those parents.
Yeah, I have learned a lot since I've been in the program. I done learned that when I need help, go get it. My case manager now help me out when I need her, as far as talking to me if I feel lonely, depressed, or if I need Pampers, wipes. It just changed a whole lot, because before I had my baby, I didn't know what to do, because I was young. Well, I'm still am, but I was young, didn't know which way to go. I had my mother, but we was kind of in a situation where we didn't have that much help. So being that I had a case manager and entered the program, it done helped and changed a whole lot. If I was not in this program, my life would be probably a little hard, but being that I have a case manager, it made it a whole lot easier. This is my last year of high school. I'm planning on finishing, and I help her, and I'm thankful because of her.
Our severely disabled behavioral clients die, on average, 20 years sooner than the general population. In the past, our psychiatrists have struggled to get primary health services for our clients. Many times, our clients seen in other settings have their symptoms dismissed as psychosomatic.
Hey, hi, my name is Ruby Hicks, and I attend the Wellness Clinic on Hampton Avenue at Centerpoint. This is the first time I ever been in a wellness clinic, and I really like it. Usually just when you go to a regular doctor, they write you out a prescription fast and let you go on about your business. But Dr. Bailey, she won't do that. She's very thorough.
Centerpoint Health received a grant from the Health Foundation of Greater Cincinnati to implement primary health care for our clients. With primary care embedded at our sites, both sets of providers can communicate and consult face-to-face.
I'm a diabetic type 2, and I can't keep it down, and I got arthritis. You name it, I got it. And I'm glad that they got the clinic here. I don't have to travel all the way across town and have to wait for like an hour to see a doctor, which I can come here and they call you right on time just for your appointment. Even if you late, they will still see you. I think Centerpoint Health is a very good clinic. Might get teary-eyed. They helped me through a lot. Just when I came to them, I didn't have no faith in me or myself. I was going through problems. So I was going to be homeless, and I didn't have nowhere to go. I still get emotional just when somebody asks me about here, because I went through a lot. But I thank God that I stuck in with Centerpoint. I got a beautiful case manager. Her name is Courtney Page, and she done a lot for me. Right now, I feel I wouldn't be happier no place else. Thank you.
Imagine a world where the problem of sexual abuse is actually getting better. Imagine a place of healing for those who have been injured by sexual abuse, for those who have hurt others with their sexual behavior, and for their families. That time is now, and it begins with the Safeguards program at Centerpoint Health.
Well, it's a comprehensive program for the treatment of sexual abuse. So very early on in our work, we realized that the distinction between somebody who's been sexually abused and somebody who's developed sexual behavior problems is a very unclear distinction. Over time, we've understood that these kids are all probably traumatized in some way, if not by physical abuse, by things like neglect and emotional abuse, all different kinds of forms of trauma that actually affect the way kids' brains develop and how that affects their overall development.
Sexual abuse affects individuals and families at all levels of their lives: physical, financial, psychological, moral, and spiritual. Our mission to prevent sexual abuse compels us to alleviate the suffering caused by sexual abuse and to reduce the likelihood of its recurrence.
Once we get to that point where we can really understand them as whole human beings in terms of their whole story, then it makes sense. It explains some things. It never really excuses anything, but it helps them to understand so that they can have a more complete way of understanding how they got to that point. Once they do that, then they can begin to envision themselves as having a better future. One where they can begin to believe that they actually can have a good life.
To receive further information or for assistance with emergency care, call 281-CARE anytime, night or day.